Summerskill up, our Executive Director of Community Nursing Services, Mobile Diabetes Telemedicine Clinic Services.
Make sure the clicker here works. Hadi, Denise, Sakuze, Skyze, thank you, Masai. Matthew Summerskill, Executive Director with Community Nursing Services and the Mobile Diabetes Clinic. Firstly, I'd like to acknowledge any hereditary chiefs in the room, and of course the beautiful lands and people of the Natli-Wutan for whose territory we meet on today. Community nursing, health nursing has had a big year, and we have made significant progress toward meeting our goals. Hiring nurses for community and rebuilding nursing as a foundational program of CSFS was among our top goal. By foundational, we mean a program that is of critical importance to the identity and core values of CSFS. This time last year in CSFS communities, we had barely 3 nurses in all. Since then, we have recruited 9. Importantly, hiring nurses removes CSFS from its reliance on external agency nurses and oftentimes the less than ideal care that comes with them. I can proudly report that our CSFS nurses are compassionate, invested in the well-being of community, and for the most part live in northern BC. Nurse recruitment has been our biggest achievement this year. Part of recruitment success is being connected to nurses and to nursing, along with careful negotiations. Our nursing leadership has worked in the field for some time and is invested in the outcomes. At this time, I would also like to acknowledge and thank our Community Nursing Director, Shauna Brooke, to my left, an extremely caring and compassionate nurse and a proud member of the Okanagan Nation, Masai Shauna. Shauna has been, thank you. Shauna has been instrumental in rebuilding nursing with me, and we are fortunate to have her. I also want to acknowledge our new EA in nursing, Stephanie Stacy in the green here, who has been key in supporting nursing with us. Masai. A leading goal of any health program should be to strengthen care, and so we ask ourselves at AGAs, how are we doing that? To get down to the basics, by hiring nurses to vacant positions, there's been better health relationships with community, which results in better care. Care that is based in community, not hospital rooms. It means things like needed injections, wellness checks, or palliative care can more easily occur in community instead of the hospital, pharmacy, or not at all. It means better support from nursing for much needed mental health support and access to care. When we speak of improving care, a case example is foot care. A couple of years ago, we had no regular foot care in community. Now in most communities, we have it 6 to 8 weeks, with priority given to people with diabetes and to elders. Foot care looks different in every community and represents multi-layers of prevention, not to mention the social benefit that many clients gain. So in the last year, foot care provided by CSFS nurses has more than doubled, not by accident, but by intention, because the need was there and that was voiced from community. So pictured above is one of our nurses is providing foot care in Sycus just a couple weeks ago. So here are our nurses in total under our envelope. Most of them new in the last year, from community nurses to remote certified nurses in TACLA, to diabetes nurses, to now foot care nurses. There's incredible skill amongst these 14 individuals, and in the next few slides, I'll go through what their service areas are. But before I do that, I also just want to quickly acknowledge nurses that have gone before us. The late Sarah Hine of Stalaco, one of the longest serving nurses in Canada. Barbie Scaling, a beautiful inspiration to many, trained as a nurse. And of course, Judith Sanford, who spent many years working in First Nations communities in northern BC. Again, we have a legacy of proud and good nurses at our organization. So if we start through the Highway 16 corridor, starting here in Notley, we have Leanne Martins. I don't know if she's in the room at all. She might be at the clinic. From the Vanderhoof area, a bright face many will have seen around, has had a huge impact already. Burns Lake communities have an absolute gem in Angela. She's worked in the Burns Lake Hospital for many years, an outdoors lady, now serves the Southside communities, Tilcasco and WFN. Psychus, Stephanie Sutton, also from the Vanderhoof area, has been instrumental in bringing key programs like STI testing, blood draws, and other programs back to community. And I've heard from community leadership about the impact these nurses are having, and it has been one of compassion and commitment to community health. Masai to all three. In Takla, we have 3 nurses, CSFS nurses, that are exceptionally skilled and invested. All work roughly 6 months of the year in Takla and 6 months out. Community members know them and trust these nurses. Thank you, Sean, Megan, and Clarice, for your compassion and care. We also have our growing number of diabetes and foot care nurses. So, there's a couple missing from here as well, but Marker on the left, our longest serving specialized nurse with over 10 plus years of service to Carrier-Sacani, has been instrumental in the growth of the MDTC over the years. Sally and Amy now represent our diabetes nurses based in Houston, which has meant that we now have multiple sites to the mobile diabetes clinic. Our care aides, has also had some restructuring in the last year. Would like to take a moment to actually acknowledge Cheryl Gagnon, who's our care aide here in Notley, who has been a leader amongst the team this past year and always goes above and beyond. So thank you to her as well. Slide I'm missing, it appears, is our nurse in Yakuche, is Amanda, another nurse from just outside the Vanderhoof area, our longest serving community health nurse, a jack of all trades from emergency to immunization to foot care. She does it all, and we thank her. Oh, here it is. It was just mixed up in the deck. Again, jack of all trades, very committed to the outcome and to the cause. So now to the mobile diabetes clinic, which again has had another busy year. We have multiple sites now. Again, 2 of our nurses in the Houston area. One of our nurses, Sauger, delivers mostly to the Nisga'a area. And it allows for our Prince George-based team members, Marakar and Mike, who are here today and in the hallway, to better serve the needs in the Carrier-Sacani territory. This has resulted in more targeted outreach, which communities in the north have requested for years. Masai to our President Chief Mueller, Warner, and past President Karina Louis and Mabel, and others for your advocacy in supporting the diabetes clinic expansion most recently. And I also want to take a moment to acknowledge Sandra Tiji, who passed away in August, and who was instrumental in always believing in and fighting for the diabetes clinic. She would be proud of the expansion and the work that has been accomplished. So when we get back to performance and we get back to outcomes, we work in health to improve the outcomes of the people we serve. And so when we look at some key performance outcomes from the diabetes clinic, we see some key ones that have stood out to me. 50% increase in our special authority approvals. That means that thanks largely to in addition to our team member Mike, who's a pharmacist, in the green shirt here, it means access to needed medications, things like Ozempic, things like insulins, things like hypertensive medications, and devices we use for diabetes. People can get access to those more quickly without having to wait for going through the doctor's appointment and waiting for that, which is barriers to care and so forth. It means also we've performed more A1C tests, and more nurses in community has all helped impact change. It's not one or the other, it's all together. As Warner mentioned earlier today, it's about the importance of holistic care. And so this is a really important slide. I mentioned that we're doing more tests when it comes to 3-month blood sugar averages, such as what we're doing in the hallway today. But importantly, we need to ask, are these tests resulting in improved outcomes and improved levels? We don't do our jobs to simply do them. We do them because we want to impact change. And after reviewing A1C data on people with diabetes living in carrier-Sakani communities, these trends are trending down. And that means less risk for heart attack, for stroke, for blindness, all of which impact First Nations at a disproportionate rate already. We need to keep these trends moving down because we know that, for instance, in things like hemoglobin A1C, 3-month blood sugar averages, lower trends results in prolonged life and prevents complications. So then we also ask another question, well, what influences outcomes? And what is some of our leading health data showing when it comes to nursing, when it comes to diabetes? And I focus on diabetes because that's my specialty, that's with the mobile, and it's a good case example when we talk about nursing as well. More support in community equals better outcomes. Better access to medication equals better outcomes. And more holistic team-based care equals better outcomes. Whether that be from nursing, from care aides, from doctors, from pharmacy, and a belief that better outcomes are possible. Data like this also provides us a baseline for continuous improvement and guiding our health interventions moving forward so that they stay going in the right direction. Again, we can't collect data if we're not going to do anything useful with it, or at least review it. So when we look at the growth with even the mobile diabetes clinics since 2017, we look at the green bar here, and that represents our follow-up with patients. It represents continuous contact with many of the same clients. And now we're now nearing 8,000, okay? So if we go back to 2017, we used to visit clients once a year, and that would be it, and you come back and you do that. Now that green bar, which is what we want to continue to grow, because that is what is resulting in better outcomes and pushing complication rates down. And if we look at, importantly again, if we look at the mobile diabetes clinic per region, it's well represented. Carrier-Sakani communities represent about 50%, probably a little under because not all of Carrier-Sakani communities are in what we call the North Central region, but it takes up well over half of the output. Having dedicated diabetes nurses in our Carrier-Sakani communities helps drive those totals and also some better outcomes when compared to the other regions. Nisga'a communities are also well represented here because they have devoted clinic support from us, from some targeted funding. And these represent everything from in-person to video to text to email to connection with other family members. It's all recorded. So when we look at goals for the coming year, when I review last year's goals at our AGA, we talked about the importance of getting nurses in community. If we get back to the basics and keep things simple, focused, and concentrated, I feel like we have more success in delivering our outcomes. So one of the things that's come up repeatedly in nursing, and we've talked about it, Shauna and I, and within our nursing team, we've discussed it, is the need for a CSFS-led cancer strategy. Far too many loved ones have been lost to cancer. We need better efforts at early detection for those cancers that we can screen for, and nursing can play a big role in that. We can screen for lung, we can screen for colon, we can screen for cervical, and for breast cancer. Nursing will play an integral role in that. We need to continue to use our data, not just for collection, but for useful analysis for which we can improve care. With our aging population, I know just from the past year with our care aides and our nursing, the demand on nursing and care aid is high. And with that being the case, we need to advocate at our levels for more nursing, more care aides in our communities with our funding partners. And finally, now that we have good local nurses in our communities, we need to strategize our efforts at exposing healthcare careers to youth, even elementary, so we can increasingly grow our own from community. Masai.